inability to have children can impact the home negatively. As a result, a couple trying to conceive and is having issues can have family difficulties arising from this issue of childlessness. In so many instances, the woman particularly faces stigmatization, not just from the immediate family, but from the society at large. Now, the interview you're about to watch highlights the different issues concerning the issue of childlessness, particularly in Nigeria. It looks at the reasons, it looks at preventive measures, and solutions. My name is Claremont, sitting for Devan.
Infertility actually is a growing problem in gynecological practice. You know, the magnitude of infertility has been on the rise generally, and compared to, if you take us back to 30-40 years ago, I would say that there has been astronomical increase in the rate of infertility. In the early 80s in this country, there were just, I can say, 2 IVF centers in Nigeria, one in Lagos, one in Abuja, or something like that, you know, and those IVF centers didn't have enough patients to keep them going, kind of. One, maybe because of awareness and belief and the rest of them, but today, I can tell you there are more than 100 centers, and yet these centers are not enough for the need of an infertile couple. So it tells me one thing, that yeah, the rate is increasing, the awareness is also increasing, you know, and the access is also on the increase somehow, yeah. The decline in fertility, actually, a lot of factors, kind of, you know, in the past, because of lack of access to care, you know, people don't come out. And one thing is ego too, because of the way fertility issue is being labeled. You know, people don't want to come out, and there's a misbelief that infertility is primarily a female problem. You know, so men don't even come at all. We're in a men-dominated world, you know. So even if the man has problem, the blame goes to the woman. So they don't come. But with civilization, education, you know, and awareness, you know, people are now coming forth. The men are coming forth, you know, and more women are now coming. So that have increased the rate, because whatever we do in science, it's only people that come to clinic that you use to, you know, quantify in real time, you know, the number that is coming. Of course, you can do a community survey, you can do a qualitative study, but that might not really hold so much power like, you know, the number you are seeing in the clinic. So, you know, with this, you see that, yes, the rate of infertility appears to be increasing. Then generally, you know, because of whatsoever thing is happening in the world, civilization, dietary changes, and the rest, you know, fertility benchmark keep, you know, declining, kind of. If you look at it critically, if you take the male folks, for instance, and what the WHO used to assess that a man has a problem, you know, in terms of sperm count now, the benchmark level, the WHO have been dropping it over the years, you know, in order to accommodate many more people into the fertile group. You know, yeah, at a point, normal sperm count was 40 million. It came to 20 million, and now we're talking of 15 million as normal. You know, despite the fact that the benchmark is dropping, the rate of people who fall below the benchmark still is on the rise. You know, so a lot of these things are happening, and we're beginning to think, you know, a lot of modern things happening, you know, is a contributing factor. Then awareness too. There could be the presence of a disease, but if there's no awareness for it to be diagnosed, you think it is not in existence. But when people begin to come out to get diagnosed, then the true figure of what the issue is begin to emanate. In our environment, a lot of tubal factor, that's on the female side. Tubal factor ranks very high, and this is as a result of mainly infection arising from different facets, from sexually transmitted infection causing a pelvic inflammatory disease, from post-abortal sepsis or post-delivery sepsis, or any infection arising from surgery and the rest of them, with this backdrop and everything. So we now begin to educate people, women, young girls as they come up, just to be decent, try to avoid exposing themselves to STIs, that's sexually transmitted infection, trying to avoid anything that could bring about infection in the genital tract, because that eventually could culminate into tubal disease. Unfortunately for the males, infertility in males is sometimes the factors that are responsible is very difficult to decipher, to diagnose, but you can easily know that there's a problem. Check the sperm count, is normal or is abnormal. This one has a problem or this one doesn't have a problem. Then from there, you now begin to dig in. Why is this one abnormal if you have an abnormal situation? That's where the difficulty comes in. A large majority of people, you don't find anything. It could just be one genetic problem that very minute, that is not coming to the fore, that's not even diagnosed. It could be lifestyle, alcohol, cigarette smoking, hard drug use. All these things have some effect on male fertility, aside from injuries. And when I mean injuries, it could be injury to the testes, childhood injuries, could be from torsion, it could be from direct injury as it could be. Torsion means when the testis twists on itself, and the blood supply, because the blood supply to the testis is along the cord, that hangs the testis. So if there's a twist, it occludes the blood supply and the testis die, in quote. So over time, it begins to shrink and shrink and shrink and shrink, and it goes out of sperm production. So all these things, the childhood infections can manifest and destroy the testes, and in later life, you now find out that there's no good fertility. So parents could come in those early stages, because the children, the boy child really have no control, might not even know what's happening. So if the testis is twisted or torsion, you can untwist immediately or within a few hours without any permanent damage. But if it goes unnoticed, of course, you're going to cause problem for that child later. Taking care of ourselves, as men, lifestyle modification, and avoiding anything that could also predispose to sexually transmitted infection that eventually could have impact on the testes and sperm production. All these are very valid. There are some other lights, treatment for some conditions, particularly cancer disease. Those ones naturally will knock off either the ovary or the testis, as the case may be. We say that, if you know that you have a situation that you need treatment with radiation therapy or with chemotherapy, which is a drug used for cancer treatment, if we know that that is going to happen, because the long-term effect is that it can knock off the testis or knock off the ovary, then we'll now begin to talk of fertility preservation. For men, you can now get the sperm and store before the person goes for treatment. So that if he goes for treatment and comes back with a 0-0, or you have something to depend on in later life to use, because it's your garment, you have stored it, you can use it some other time. For women too, there's egg storage now, as it were. Before going for such treatment, you can preserve those eggs, and after the treatment, because the womb is still there, even though the egg source must have been destroyed from treatment to preserve your life, then you can go on with your fertility plans. So these are things that actually we can do to preserve or enhance our fertility. Technically speaking, infertility is not hereditary, technically. However, there are some disease conditions that are associated with infertility that could run in a family. If such disease condition exists, it can be transmitted from father or parents to the children, and because the children have those disease conditions, they also might be faced with fertility challenge. But infertility as a broad group, as an entity, having a pattern of inheritance, the answer is no. A lot of options are available for management or treatment of infertility. Before we begin to talk of options to make it smoother and better, in a better direction, you want to thoroughly investigate the couple to know what their problem is, because sometimes we might be looking at something very big, meanwhile the solution is just small. Sometimes the couple might even have a misconception about what fertility is, or in totality, So it could just be that they don't even understand their normal physiology. The woman don't even know that there's a time that is fertile, that we have to concentrate on. So counseling comes in first, First of all, we want to make a diagnosis. What is the problem? What is the main challenge? Then, before we now list options. And simple options as simple as counseling, to just know the right timing, for a couple to meet, for conception to take place, have solved a lot of problems in some quarters. Before we move to simple options like trying to induce ovulation, if it is an ovulation problem, because some people don't ovulate, or some ovulate, they don't ovulate well. You want to enhance ovulation, and time when the couple should meet to bring about pregnancy, From there, it could also be that the sperm function is not optimum. The man has a low sperm count, not absence of sperm. You might want to just give some medication to see how, you can optimize the sperm count, so that this will allow for fertility to continue. The next phase, when we do all these preliminaries, and there's still a challenge, or there are even some people who will come, that there's a major challenge, we'll now go a step higher. And that step higher could be what we call insemination, artificial insemination, which will either, usually intrauterine insemination. You get the sperm, you put the woman through ovulation medication, or monitor her natural cycle to know when she's going to ovulate, and get the sperm from the man. Prepare the sperm very well, probably because there's some little challenge with the sperm, so you now prepare and take the very active part of the sperm and inject it into the womb at the point that ovulation is supposed to take place, so that from there the sperm can go towards the tubes and interact with the egg and try to do the fertilization.
And it's a wrap on today's edition of Lifeline. Thank you for watching.